Okay, good. Relax now. This young lady is 27, and she's got very, very prominent corrugator muscles, and you can see the whole outline here. Frown your brow for me. Now you can also see here where they attach to the skin, and so whenever you inject anyone in this area, you really want to have them gesture, relax now, and frown again, and try to look through the skin and see exactly where those muscles are. Now, she has a very, very low brow, and the last thing I want to do would be to inject her forehead and allow her brow to come down, because she would feel like she was wearing a hood. So we want to release the muscles that pull her brow down and actually let her frontalis take over and pull her brow up. So she's going to, by treating this area, she's actually going to get a little bit of a brow lift and brighten her eyes up a little bit. Okay? So we're going to treat the procerus here. How you doing with that, okay?
Mm-hmm.
And then I like to put my thumb right in the orbital rim. Frown your brow. Relax now. And so I grasp the muscle, and it goes right into the muscle. And I'm going to use 20 units on her labella. Okay, doing all right?
Mm-hmm.
Now after injection, I tell patients not to push on these spots because we want the product to stay there. And I have her frown her brow for about 90 minutes to help mobilize the uptake of the neurotoxin. Okay, frown your brow. So you can see the contribution of the procerus here with the horizontal creases. Frown again. And when I have the patient frown, I want to see how far lateral the corrugator muscle goes. Frown again. So you can see she's only to about here. In some patients it'll be way out here and you'll need to treat out there. Frown again. Okay, good, now relax.
Because I've been getting it for so long.
Yes, it's a little bit weaker.
Yeah.
Right. Okay, frown again. Good, relax. Corrugators. I'm using 10 units of botox here. Frown again. Good, relax. And I put my thumb again on the orbital rim. Good. All right, so I'd like you to raise your brow, frown your brow, and smile.
I can't feel
You can't feel it. All right, we're going to use 20 units of Botox and treat the entire upper face. So we're going to cheat every area just a little bit. So smile, and put my finger here in the orbital rim, and do 2 injections where she has the most wrinkling. There you go, unsolicited. Okay, frown your brow. Very mild procerus, so I'm going to put just a little bit there. Then frown again. Good, now her corrugators, the bulk of them are here, but she's still pulling from here. So I'm going to sort of split the difference. Frown again. Good, relax. Good. Now raise your brow. Good, relax. That's where she has the most motion. I'm going to go all the way out lateral here. Raise your brow again. Good, relax. All the vessels here that we're trying to avoid. Raise again. Good, relax. Raise again. Good, relax. Raise again. Good, relax. Raise again. Good, relax. Finish this closer. Good. So she's got a low brow, and I don't want to treat very low because it's going to drop her brow. But she doesn't like these wrinkles here, which certainly I can treat those and still allow her to raise her brow. So we're just going to treat right in the frontalis muscle, just along the hairline. It's an important area to remember to treat, because sometimes if you don't treat it, people will end up with a ridge of wrinkles there. Okay, now frown your brow. All right, so now we're going to treat the corrugators. Frown again. Good, relax. You can see she's got a long muscle all the way out to here. If you don't treat the whole muscle, they're going to end up using the accessory muscles to pull things in and think that the Botox didn't work. Okay, turn towards me a little bit. Good. So frown again. Good, relax. Muscle comes all the way out to there. She's got a long muscle. So we're treating with about 18 units because we're going to save a couple for her orbicularis muscle. Do a little in her procerus. Okay, now. All right, so smile for me. When she smiles, she bunches her orbicularis muscle here. So I'm going to put 1 unit right in her mid-pupillary line. Look up for me. A little pinch. Does not have to be deep. She's going to get a little more of an eyelid show. It's going to bring her lid down just a little bit. So mid-pupillary line, we're going to go right in her orbicularis muscle. And that's it. Done. Raise your brow for me. We're going to treat her forehead, and you can see that the forehead lines go all the way from temple to temple and all the way up to her hairline. So if I only treat centrally here, she's going to get a funny pull of her brow. Also, if I only treat down here, she's going to have creases up here. So I want to treat really the whole muscle. Now relax your brow for me. Her brow is not too low, even though she's got a little asymmetry of her eyebrows. Her brow is above the orbital rim, so I'm not worried about brow ptosis. She does have a lot of lines, though, because she's getting a little bit of heaviness of her upper lids. So I have to be careful not to overdo it, not to drop her brow and accentuate this heaviness. So I'm going to go lightly on her forehead, do a little bit here in the corrugators to give her a little bit more of a brow lift. Okay, good, relax now. So we're going to march right along forehead. Raise your brow for me. Good, relax. Okay, raise your brow again. Good. Frown your brow. Good, relax. Frown again. Good, relax. So now we're going to evaluate the glabella, and we're going to have frown your brow. And what you want to do is look through the skin to see where the muscles are. Now relax. So we know we have procerus, and we know we have a corrugator here, which is inserting onto the skin, and you're seeing a little indentation for the distance that the corrugator travels. Some people have a very small corrugator that goes more vertically. Lauren has a small one that goes more horizontally. Frown again. So this is the area we want to target. She also has a little horizontal crease here from the procerus. And this is botox. So now I've treated the procerus. Frown your brow again. Relax. I like to grab the muscle and put my thumb right in her, the hollow of her eye here, right on the superior orbital rim, so that I almost push the muscle into the area between my fingers. Sometimes you get bleeding, it's okay. Same on this side. Frown your brow again. Relax. Almost grab the tail of the muscle here and inject. Sometimes I'll use a full 20 units, and sometimes I will use a little less. I'm going to use a little bit less on her because we're also going to inject her mentalis muscle. I'll hold pressure there. All right. So Lauren has had a chin implant, and she gets a little contraction of her mentalis muscle here. Can you contract your chin for me? So what we're going to do is place just a little bit of this leftover botox, about 5 units, in each mentalis muscle. And that's done. We're going to be injecting the forehead and the glabella now with botox. Raise your brow for me. She has an extremely high forehead with ridges that go all the way up to her hairline. If I don't treat that and only treat here, she's going to be nice and smooth here and then have all these ridges here and will not be happy. So I need to make sure I extend it all the way up into the hairline. Frown your brow for me. And then we're going to treat the corrugators here. You can see where they're inserting. She's got a long corrugator. She's a little short lady, but a long, long corrugator. And I need to make sure that I inject all the way out to where it attaches to the skin. Okay, you ready? Here we go. I'm going to start with the procerus. I always start here because it doesn't hurt people very much. Frown. Good, relax. I'm looking through the skin and I'm looking exactly where the muscle is. Frown. Okay, I'm going to come just a little bit out here, superficial. Frown again. Good, relax. Frown again. Good, relax. Can you make sure that that is still okay? Yes. Still okay? That's good. Now we're going to inject her forehead. Raise your brow. She has these little crescents here that I don't want to have her be concerned about. So we're going to inject where those little crescents are. And then I'm going to march along her forehead. I'm using a total of 20 units of Botox. I could also use 60 of Dysport. I find with Dysport, patients get a little more motion. So sometimes that's nice for a more natural look. If they want no motion, I prefer Botox. Okay. Now we're going to treat the forehead and brow complex. Raise your brow for me. So she's got some motion here, plus these crescents here that people really hate. So we're going to treat that and then frown your brow. She doesn't have terrible movement of her corrugators, so I'm going to split a 20-unit dose between her corrugators, procerus, and forehead. So frown for me. Good, relax. You can really see the action of the procerus here, looking through the skin. Frown, relax. And frown again. Good, relax. I'm looking to see where the muscle inserts onto the skin, and I get a little more superficial with the injections at the insertion. Frown again. Good, relax. Now raise your brow. You can see her crescent here. I'm going to inject a little bit higher above that crescent and relax that. Raise again. Good. Relax. Now raise your brow. Good. Relax. So I'm going to just go straight across her forehead. Again, trying to avoid the vessels, trying to be intramuscular. Sometimes people with very high foreheads get a nice result here, and then they have ridges here. Raise your brow. She doesn't really have a lot of creases here, so I think with the degree of treatment of the spread of the Botox, this should be okay. If she would come back and complain of extra creases up here, I could certainly put a few more units of Botox up there. In this patient, open your eyes for me for a second, you can see that her brow is relatively low, and this is someone who I would be really nervous about injecting her forehead muscles. So we're going to inject the corrugators in order to give her a little bit of a brow lift. I often determine brow position by the location of the brow in relation to the bony rim. And really her brow should be here. So you're starting to see a little excess skin here, a little drop of the brow. And if I make it so that she can't raise her brow with Botox or neurotoxin, she's not going to be able to raise her brow, and this is going to be heavy. So what I'd rather do, rather than treat her forehead, we're going to treat her glabella and give her a little brow lift. So the first thing we're going to do, this is Botox, is inject in the procerus. Now, frown your brow. I look to see where the muscle is inserting on the skin. Relax now. And I know that that's how far out I need to go to inject her entire muscle. Now the muscle actually gets a little closer to the skin surface. Frown again. Relax. So I know at this point I need to be a little more superficial. Okay? Now we'll do the other side. Okay, frown again. Okay, relax. You can see that the muscle is inserting here. And I want to be about a centimeter above the bony rim so that she doesn't end up with a ptosis. And this is going to be 20 units of Botox. Frown again. Good, relax.